Fatty liver disease has a global prevalence of 25% and has become one of the leading causes of chronic liver disease. The liver is the second largest organ of the human body and sits just behind your ribcage on the right side of your abdomen. It helps process nutrients from food and drinks and filters harmful substances from your blood. So, what is fatty liver or non-alcoholic fatty liver disease? Fatty liver disease is a condition caused by extra fat storage in the liver. It is also known as hepatic steatosis. Having small amounts of fat in your liver is normal, but too much can become a health problem. When fat reaches 5 to 10% of your liver's weight, it can cause fatty liver disease. It causes widespread inflammation linked to severe health issues like liver cirrhosis, heart disease, diabetes, and cancer. Today's video will talk about how to reverse fatty liver disease. Number 1. Weight loss. If you are obese or overweight, the best way to reverse fatty liver is to lose weight. Excess fat causes insulin resistance and inflammatory signals. Due to insulin resistance, the pancreas must produce more insulin to maintain normal blood glucose levels. Losing weight helps in normalizing liver enzymes and also improves liver inflammation. According to studies, losing 10% of body weight can reduce liver fat, resolve inflammation, and possibly improve scarring. Number 2. Avoid alcohol use. The alcohol you consume is broken down by your liver, so it can be removed from your body. During this process, harmful substances are produced, which can damage your liver cells, promote inflammation, and weaken your immune system. So, abstaining from alcohol is the best way to reverse fatty liver. You can also see a therapist or participate in an alcohol recovery program to keep yourself abstain entirely from alcohol. Number 3. Coffee. Coffee without added sugar or creamers is another effective way to improve fatty liver. It has been found that coffee reduces the gut's permeability, making it more difficult for people to absorb fats. Caffeine also lowers the number of abnormal liver enzymes in people at risk for liver disease. According to research, caffeine also decreases the risk of advancement of liver fibrosis in those already diagnosed with NAFLD. You can drink up to 3 cups of coffee per day. Number 4. Exercise. Exercise is also essential in treating and reversing fatty liver, particularly resistance training and aerobic exercise like running and swimming. Recent studies have found that resistance training specifically impacts a fall in liver fat levels. Resistance training also helps lower ferritin, a protein in the liver that facilitates iron storage. If the ferritin level is elevated in the body, it can cause liver damage. Even a small amount of exercise can help you reverse fatty liver. For instance, walking 1,000 steps extra daily can decrease liver fat by 0.87%. Number 5. Choline consumption. Foods rich in choline are eggs, many vegetables, mushrooms, and red meat. This compound is essential for healthy liver function, and deficiency of it can cause fatty liver disease. According to research, regular choline consumption through a diet significantly lowers the risk of fatty liver disease. Choline plays a vital role in fat metabolism in the liver and supports the membrane of mitochondria, the energy component in cells. Number 6. Vitamin E. Vitamin E is a potent antioxidant that can reduce liver inflammation and is used to treat NAFLD. About 20 mg of vitamin E contains more than 100% of the daily recommended value. Sunflower seeds are a good starting point if you want to increase your vitamin E consumption naturally. Number 7. Turmeric. Turmeric contains high doses of an active ingredient called curcumin that reduce markers of liver damage in people with fatty liver. Turmeric ensures the smooth and natural flow of the liver cleanser called the bile duct. It also prevents toxins and alcohol from turning into harmful compounds that can damage the liver. Adding turmeric to a glass of hot milk makes the absorption of curcumin easy. Number 8. Artichoke. Artichoke leaf extract protects the liver from damage and promotes new tissue growth. One study found that taking artichoke extract daily for 2 months in non-alcoholic fatty liver disease reduces liver inflammation and less fat deposition. Artichoke also increases the production of bile, which protects the liver from harmful toxins. Remember, this video is for educational purposes. We are not giving you medical advice. You should always consult your doctor if you need any professional opinion. Do you find this video helpful? If yes, then make sure to like this video, subscribe to our channel, and hit the bell notification button.